Alrighty, so it is 7 a.m. Eastern time for me here in Boston, so it's time for us to get our class started. I'd like to introduce myself first. This is our 30-minute managing back pain class, managing back pain with a foam roller. So this is going to be almost entirely a movement-based class. We're going to be using the rollers to do some stretching, some strengthening, of course, some foam rolling. And then we'll just save a brief bit of time at the end of class for questions. So my name is Allie. I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I've been practicing here in Boston for the last 5 years, and I've been teaching with the Community Online Academy since it started back in March. So this will be a fun program for you guys today. As always, with all of my classes, I offer a number of ways to modify and progress the exercises that we're doing. So especially for this class with the foam roller, there's a lot of opportunities to personalize this class for you. So please listen to your body, listen to my cues, and take modifications if you feel you need to. And that way you will get the most out of this program for your body. So with that being said, we're going to start on our mats, but we're going to actually start in the all fours setup today. So if you do know that you have relatively sensitive knees to kneeling, go ahead and roll up your mat a couple of times. You can, even if you need to, have a pillow nearby to place underneath your knees. So what we'll do is take our rollers perpendicular to the length of our mat, and then we're going to place our hands right on top of the roller and then set up so that our hips are right over our knees. So it's kind of like a traditional all fours quadruped position, but we are a little bit elevated through our hands. So we're going to just start with some breathing here. And as we set up in this posture, like I said, if you have knee sensitivity, you can roll up your mat or put something underneath your knees. We're going to go through a few cat-cows, and what that looks like is rounding your spine, allowing your head to drop down and hang towards the floor, and then allowing your ribs to drop down, lifting your head, opening up your heart. And this is, for many of us, the first moving that we're doing during the day. So don't be afraid to make this movement small. It should be comfortable. It should just feel like a gentle stretch. If it's painful or pinching, back off a little bit. But see if you can imagine creating this cat-cow motion from your rib cage. So you're using your ribs to lift up, rounding up to the ceiling, letting your head hang down, and then dropping your ribs down to the floor, allowing that to open up your heart, lifting your head. We're going to pair this in with your breathing. Exhale, let your head hang down. Inhale, let your rib cage drop down, head lift. The roller should be mostly still here as you do this cat-cow motion. That tells me that the movement is actually happening in your back and not just in your shoulder joint. So sometimes when we do this cat-cow motion, we can get a lot of movement from our shoulders, but not as much movement from our back. We'll try just a few more here. And then letting the back drop down. 2 more here, rounding. See if you can puff up a little bit more air into the back of your ribs, and then allowing your spine to drop down. 1 more time here, we round up, up, up. Drop the spine down, finding that extension. And then very gently settle somewhere right in the middle. So this is relatively our flat back, our neutral spine. Now we're going to take this into some movement. So as you start to roll, you're going to push the roller forward. So it's going to come onto your forearms, letting your head drop down between your shoulders. And then we'll pull right back up to that all fours position. Now, I have quite flexible shoulders. You may not be able to get into that same range of motion, especially early on in class. Be gentle with your body. Push the roller forward. Keep your hips up in the air, as though you are like a puppy dog stretching their paws in the morning. So you're flaring your hips up to the ceiling and just rolling that roller forward. This also doubles as a really nice foam roll and a gentle stretch for our forearm muscles, which can sometimes be tight after a lot of typing or mousing. So we'll keep this in mind, even though this is our back pain class. 2 more times here. Good. And then we're going to hold it out low on this next one. Now we're doing this early on in class. This is a stretch for our upper back, but it is also a nice decompressor for our low back. So once we're in this position, we're going to practice shifting our body weight back into our hips and then shifting forward again to stack our hips over our knees. If you need to bend your elbows here for shoulder sensitivity, you can certainly do so now. But we're just practicing adding and deepening that stretch into the back of our hips. And so the back of our hips helps to control how much our spine needs to bend when we bend over and when we go up and down stairs. So you may feel that stretch in the front of your hips, you may feel it in the back of your hips. Just notice that for now. We're going to work into this a little deeper in class later. We'll try just 2 more breaths like this. Good. And one more time here. Good. And then you can roll yourself all the way back on up to sitting. Nice job. Shake it out. We're going to continue with the work on our upper back. And so from here, you're going to keep the roller in that perpendicular direction, but this time turn so that the roller goes right between your shoulder blades. Now, if you have a hoodie on or you have longer hair, you're going to want to get that out of the way before you lie down because it can get tangled up in the roller and be very uncomfortable. So we're going to lie down with the roller just below our shoulder blades, or sort of right between our shoulder blades. Knees are bent, feet are flat. Notice I'm holding onto the roller here just to get set up. And then I'm going to hold my head in my hands. And I really do want your neck to be relaxed here. So start to imagine your hands like a little hammock for your neck. Bring your elbows narrow in your peripheral vision and make sure that most of your body is relaxed in this setup. You're now going to lift the hips up and start to roll right to the base of your neck and then down just below your shoulder blades. So all we're doing right now is rolling back and forth, and we're just taking time to assess how our back is feeling. We're getting a couple benefits from this rolling in this pattern. We're really working out the muscles that lie along the sides of our spine, as well as the muscles between our shoulder blades. We're starting to get a move of the fascia, and the fascia is, I like to think of maybe as the saran wrap that holds everything together. So it surrounds all of our muscles, our ligaments, tendons, and bones, and kind of keeps our body all together. But the fascia itself can be tight, and it is all connected. So even though we're addressing the fascia in the upper back, it can influence how our lower back feels. So keep the elbows in the peripheral vision. Head should be heavy and relaxed into your hands. And during this part, just make sure you're breathing comfortably. It doesn't have to be an inhale or an exhale at any particular time. Just breathe. We'll try a few more rolls like this before we add in a little bigger stretch into extension. So we'll pause at a particular spot that feels tight. I'm going to stop just below my shoulder blades and place my hips back down on the floor. From here, we're going to let the spine drape over the shape of the roller. Now, a couple common mistakes here. You're not just letting your head drop back. In fact, your neck is actually quite flexible compared to your upper back. So you want to limit the amount that your neck moves to allow your upper back to get most of the stretch. Now, conversely, our low back also tends to be a little bit more flexible here. So you may find that your rib cage is lifting way up to the ceiling. See if you can draw your ribs down, almost like you're keeping your core engaged as you drop back to create this imaginary accordion type movement through the top of your ribs. And this is a stretch back into extension. Extension is the opposite position of what we do when we sit, which is flexion. That's being bent forward and being rounded. Good. Now you can change spots. You can roll a little bit, maybe come a little higher, a little lower, and try the same thing. And so as you do these little drop back and stretches into extension, you can choose to just hold this. You can also choose to lift in and out of that stretch. So if this is a little bit uncomfortable, especially to hold it, you may want to practice coming in and out of the stretch instead. And that's totally fine. And then you can explore maybe a spot a little bit lower, a little bit higher. Just check in and see where your back feels like you need this the most. And that's how you'll make this program customized for you. And you may feel some cracking, popping, clicking when you do this. That's okay, as long as it's pain-free. You may be doing a good thing by creating mobility in your spine. So from here, we're going to go back to that rolling. So hips are lifted. You're going to continue that rolling front to back, but this time as you roll, tip your right elbow towards your right hip. And what that's going to do is open up your left side. So it's as though the space between your rib and hip on the right side is getting smaller to make that left side more open. And just notice how that feels. Maybe it feels tighter, maybe it feels better. You can do the same thing going to left elbow towards left hip and just notice where your body needs more attention. So if it's both sides, that's okay. But if it's one side more than the other, spend a little bit more time there. This is your choice to get to work in where your back needs more attention. And maybe it's right in the center. You can also go back to just rolling with that equal space between your ribs and hips on both sides. Good. Now the other dimension we can try here is to go into some rotation, and that's going to be lifting one elbow up to the ceiling and one elbow down to the floor. This will help you to get into your side body, particularly your lat muscle, which is a shoulder muscle that also connects all the way down to your low back. It can be a little bit sensitive, so if you need to place your hips down or back off, that's okay. You can also try the opposite side and see how that feels. So this time, left elbow up to the ceiling, right elbow down to the floor to get into my right lat muscle. Good. So spend an extra moment or two on the side that you feel you need it. If you need to take your bottom down and take a rest at any point, you can certainly do that. And try and keep your elbows in your peripheral vision just to notice how that opens up. It actually pulls your shoulder blades off your back, and that helps you to get into your upper back more than just your shoulders. You can even test that by opening up your arms and feel how your shoulder blades come together, rolling like that. And then if you close your arms, see how you can get a little bit deeper into the muscles behind that surround your spine and even into the joints of your upper back. Good. We'll try 2 more rolls just like this. Excellent. And one more time here. Good. And then gently press yourself on up to sitting. So I want you guys to take a moment. We just did all that rolling for our upper back. Take a moment to do some of that deep breathing. So because our upper back is attached to our rib cage, better upper back mobility means better breathing. And better breathing means better control of those deep abdominal muscles that support our low back. So not only are we getting better mobility from that exercise for our upper back, we're allowing ourselves to breathe a little bit better. So try a couple of those deep inhale, expansive breaths in as though you're opening your ribs in all directions. And then when you exhale, let that breath go. Try a couple more deep breaths like that. Imagine your belly as a balloon, like you're filling that balloon up with air in all dimensions. And when you exhale, you let all of that air go. So you're trying to squeeze that balloon again from all directions. Try one more breath like this, a big inhale and open, and then exhale to let it go. All right. Nice work, guys. So I hope that you feel like you can breathe a little bit better after doing that exercise. You certainly all look like you are able to sit up a little bit taller, which is awesome. So we're going to keep our roller in this perpendicular direction and start to get into our glutes, our hip muscles. So our glutes consist of muscles down the back side of our hips, but also on the sides of our hips. So we're going to try and get all dimensions of our glutes today. What I recommend starting with, I'm going to do my left hip first. is to kind of hold the roller steady with my hands and then sit down right on top of the roller. So right now I'm pretty even between both of my hips. What I'm going to do to get more into my left side is place my left hand down on the floor behind me and then tip my knees slightly to the left. Okay, and then you can just start to roll. You're going to roll right up to the top of your pelvis. So if you reach for that hip bone in the back, you'll feel sort of a crest of where the bone stops, and then you have muscle. You want to go right along the length of that bone. And that's because there are actually these very thin glute muscles that lie right on top of the bone. You can practice here rotating your chest up to the ceiling to get the more central middle part of your glute, and then practice rolling yourself towards the left to get more into the sides. And so different people are going to be tight in different spots. We have a lot of small muscles here that are all layered upon one another. And different people are going to be tight in different parts of those muscles. So just kind of use this first moment to explore and notice where you feel the tension. If it feels like sharp zinging pain or you're getting any numbness or tingling, you don't need to spend too much time on that spot. There's a good chance that you're actually rolling over a nerve, and that can be quite sensitive and not super effective. So see if you can find a spot where it is intense, it feels like a lot of pressure, it feels like tightness, but it's not zinging pain down your leg. The other thing to watch out for when you're foam rolling through the glutes is this big bone on the side of your hip, which is called the greater trochanter. It's actually a part of your femur bone that comes out to the side. So that big bone has what's called a bursa on top of it. The bursa is a fat pad, and it's meant to give padding between the bone and the tendons of these muscles. The bursa does not like to be foam rolled over. In fact, it can get really cranky and angry if you spend too much time foam rolling over it. You will know because it's very, very sensitive. It's very, very painful. And you have to be really tipped sideways to get to it. So just watch out for that. One word of caution as we do some more of the lateral hip work. Now we're going to add in a couple dimensions here today. So if you would like to deepen your stretch a little bit, what you're going to do is take your right ankle on top of your right thigh, on top of your left thigh rather, to put a little bit more body weight into that left side. And what you can also do is challenge yourself to creep your left foot closer to the roller and just see how that changes the amount of pressure you're putting down. That's going to put more body weight into the roller. So especially if you've been taking this class a couple of times and you want to try and get a more a little deeper experience because you've been foam rolling, you can challenge yourself to get your body in sort of a more compact position to put more weight down into the roller. Now, if that feels far too intense, walk your foot away. Give yourself a little bit longer base of support to take out some of that pressure. You can also choose to pause over one spot if that feels okay, and just breathe and just sort of check in with your body. My goal for this, we're actually going to retest that all fours position after what we do here on the roller. And I'd like you guys to sort of see, well, this is a hip muscle, see what that does for your back mobility and see what it does for your ability to bend over without stressing your back. And my hope is that you have a little bit more range of motion. So we'll spend just another moment here. And my goal is for us to get about a minute or two on each spot. And then we're going to go over to the other side. So now walk your right foot down, bring your right hand down, and you're going to turn your body sort of towards the right. You can decide to stay a little bit more central. That's going to be your glute max, which is a hip extensor. That's what you use to bring your leg behind you when you're running, walking, sprinting, jumping. If you turn to the side to get more into the lateral side hip muscles, those are more the muscles that help with rotation, which is things like twisting and turning. They're also what helps to keep your spine stable when you're doing a unilateral type motion. So what that means is something like carrying a heavy bag of groceries on just one side of your body. The side hip muscles is what helps keep your spine sort of straight so that you're not tipped over to one side. So depending where you're feeling the tightness, that may give you some data as to what's going on in your body, what it is most affected by. And one thing I always like to comment is that oftentimes the spots where you feel the tightness are sometimes happening because that muscle is weak. And our body will tighten up because of weakness as a way to create more tension and stability in a muscle that doesn't really have the true strength that it needs. So that's just something to think about and something to notice. This is not a very strength-oriented class, and this is actually a nice thing that you can do before you do some strengthening, but just notice it when you're thinking about what kind of long-term changes you can make to protect your back, that maybe that's an area where you need to work to build some more strength in. Now we can deepen this stretch again by taking your left ankle now on top of your right thigh. And if you want, you can creep your right foot in closer towards your bottom. You can also walk your right foot a little bit farther away. You can choose to just pause on one spot if you feel a particular one that's tight or sore. And then you can continue to roll back and forth if that feels better, to just work in and out of those zones. You guys are doing awesome here. We're just going to spend another 20 seconds or so on this right side before we retest that bending backwards, that all fours position. Good. We'll take one more deep breath and get a nice deep roll, making sure you're getting right up to the top of that hip. And then we'll place both feet down. We're going to keep our roller there and come right back to that all fours position. So we'll just do this for a second as a quick way for you to feel what kind of changes we just made in the hip. So your hands are going to go on top of the roller, your knees are down onto the floor. We're going to start by rolling our hands forward, and hopefully our upper back is a bit looser, and then you can practice shifting backwards and shifting forward. So this is working to bend our hip joint back. And I know for me, both my upper back and my hip joint feel like I have a lot more movement right now. Good. Okay, so come on up. So we're now going to work into a position where the roller is lengthwise. So this is where if you have a shorter roller, you're going to need to modify. So I'm going to turn my roller so that it is parallel to the length of my mat. And then I'm actually going to lie down right on the roller so that the entire length of my spine from the top of my head down to my tailbone is on the roller. And the easiest way to do so is start by sitting right on the end and then walking your hands backwards until you're lying down on the roller. And if you have one of the shorter rollers, make sure that at least your head and your upper back are on the roller. You can then either place some pillows under your hips, or you can lift your hips up and just sort of hold them in a hover in a bridge. So just find your comfortable setup where you can feel your head, you can feel the back of your rib cage, and you can feel your tailbone down on the roller. And I always like to take a moment here, just pause, notice what this feels like. This is our most stacked spine position. So if it feels like a stretch somewhere, this may indicate to you that this is not necessarily where your body spends a lot of time. And then we're going to use this to help get into some balance work. And balance work is important, again, for our core muscles. That they're not the core muscles that do crunches, they're not our six pack. They're actually deeper muscles around our spine that help to keep our spine still during certain movements. So we're going to walk our feet fairly close together, about hip distance apart, and then try lifting your hands up and seeing if you can get your balance here. And you might quickly see what side of your body wants to do most of the work. You're going to roll towards that side. So see if you can center yourself, pushing down equally into both of your feet, using the back of your shoulder blades to gently hug the roller. Good. Adding a little tuck to your chin, lengthening the back of your neck. Now, if you've taken my class before, you've done the marches here. So that's a leg movement. What we're going to try today is an arm movement. So trying to keep the roller super still, you're gonna let your left arm drop out to the side and then pull it back to the center. And then your right arm out to the side, back to the center. Now, I really don't care how far your arm goes. What I care about is how still your body is on the roller. So are you compensating by tipping your knees to the side or feeling your whole body start to stretch over to the side? I want it to be so that your spine and your legs are totally unmoved by the movement of your arms out to the side. And what this really helps us with in real life is the stability of our spine when we're doing rotary type twisting movements, as well as the stability of our spine when we're reaching for something that's far away from us or maybe high above us. So let's imagine like a dish or a heavy box that's up on a shelf away from us or up high. And you may find that you can move one arm really far, it's no problem, and the other arm you have a little bit more difficulty. So just notice that, and maybe this gives you some data about which arm you might be better off using to do some of that reaching. Good. Let your head, neck, and jaw relax. Push down into your feet for a little bit of extra stability here. That's it. You guys have got this. We'll try 3 more. Good. 2 more. And then 1 more time. And because we're in this setup, we're going to just let our arms open out to the floor and just take a moment to feel a nice stretch. This is really a pec stretch. Again, mostly for our upper back to open up the chest. Allow your shoulders to fall onto your back. You can walk your hands up as high as they are comfortable and able to stay down on the floor. I like to keep a soft bend in the elbows. That takes the pressure off of the nerves that go into your fingers. And just breathe. I recommend that if you spend most of your day sitting, that you spend some time on your roller like this. This is a nice one that you can do. It's very passive. You don't have to do anything. You just lay here. Gravity does its job of letting your spine kind of drape over the shape of the roller, and it keeps your back in a very neutral position. So you can spend really anywhere from a minute up to 3 or even 4 minutes in this position if this feels good for your body. So for the purpose of this class, we'll just spend a couple more seconds here so we can get into a few other things. And then we're gonna roll to the side to come off that roller. So there's really no graceful way to do it. You kind of wanna just let your body come off. Thankfully, you're not too high from the floor so it doesn't feel uncomfortable. So the last thing we're gonna roll out today is the front of our quads. And I really like this type of rolling because it also doubles as a nice plank, which is some good core strengthening for our back. So we're once again gonna turn that roller back to the perpendicular direction. And we're gonna try and get the meaty part of our thigh muscle, so right on the front of our thighs, onto the top of the roller. So the easiest way to do so is to walk down onto your forearms, let your thigh muscle rest on top of the roller, and keep your feet down. So it's really like I'm in this long plank shape here. So think about lifting your rib cage away from the floor, flattening out your upper back. And then from here, you're just gonna walk or sort of army crawl your arms forward and backwards to go the length of your thigh bone. And you don't want to go onto your knees. You're going to go just to above your knees and then all the way up to the top of your hips. This is a pretty long muscle here. Now, if you want to put more pressure in, you can lift your feet up and just use your arms. You can also try stacking one leg on top of the other. So that's going to bias that I just put my right foot on top of my left. I'm going to have more body weight in my left side. And then you can do the same thing and sort of retest, okay, do I need to spend more time on my left side or my right side? And just check that out. Our quad is made up of 4 muscles, 4 small muscles. That's why it's called our quad. So you can rotate your legs a little bit in and rotate them a little bit out to feel the difference between those more outside quad muscles and the more inside quad muscles. So different people are going to be tight in different spots. And again, just notice that there's not a right or wrong way to go about this. And you want to spend about a minute or two here right on the front of our thighs. These are muscles that tend to be actually overworked in most people. I find that a lot of people are weak in their glutes and their hamstrings, which are the muscles on the back of our legs. So the muscles on the front of our legs tend to get overworked. So this is a nice one to spend a little bit of time doing because it often plays a big role in supporting our back, really when it doesn't need to. Good. So we'll just spend another moment here. Excellent. And then we'll carefully press ourselves up and back and take a moment to breathe. So I'd like to spend our last minute here of class answering any questions that you guys have about back pain, about foam rolling, anything that came up from class today. Since we are in a small class for our 5-star members, you're more than welcome to unmute yourself if you'd like to just ask a question. You can also write them to me in the chat. So I'll be checking that. And then I do ask if you guys have a moment to stick around to please take time to leave feedback for this program. I'll show you how to do so in just a moment.